So question is, a young female presented with complaints of lower abdominal pain. So there is a female who has lower abdominal pain. She is also having vaginal discharge. You ask the history, there is history of intrauterine device use for the last 3 to 4 years. When you do examination, the patient had fever, there was adnexal tenderness, and there was cervical motion tenderness, and there was increased ESR and C-reactive protein. What is the probable clinical diagnosis? First is ectopic pregnancy, second is acute appendicitis, C is diverticulitis, D is acute pelvic inflammatory disease. So this question has directly been taken from the Datta textbook of gynecology, which writes clinical diagnostic criteria for pelvic inflammatory disease, which has taken it from the CDC guidelines of 2006. So there are some minimum criteria, there are some additional criteria, and there are some definitive criteria. So what should be minimum criteria? That it should be present, at least this should be present. So the first is lower abdominal tenderness. Is it present in the question in this patient? Yes, lower abdominal pain is present. Second is there should be adnexal tenderness. Is it present here? Yes, adnexal tenderness is present here. Then you have the cervical motion tenderness. Is it present here? Yes, cervical motion tenderness is present here. Now we have some additional criteria. Oral temperature more than 38.3 degrees Celsius. Is it present here? Yes, fever. Patient is giving the history of fever. Then mucopurulent cervical vaginal discharge. Yes, we have the vaginal discharge. Then you have the raised C-reactive protein and or ESR. Is it present here? Yes, increased ESR and increased C-reactive protein. So what should be the probable clinical diagnosis? The probable clinical diagnosis is acute pelvic inflammatory disease. So correct answer is acute pelvic inflammatory disease. So what are the criteria that are left that is not given in the question? There is laboratory documentation of positive cervical infection with gonorrhea and chlamydia trachomatis. So this is additional criteria. Now definitive criteria is we have histopathological evidence of endometriosis and biopsy. So you have taken a biopsy, and on the biopsy you find that there is evidence of endometritis, inflammation of endometrium, endometritis. Then you did imaging study, which can be transvaginal sonography or MRI. There is evidence of thickened fluid-filled tubes plus minus tubo-ovarian complex. And third is laparoscopic evidence of pelvic inflammatory disease. So that's why the answer will be acute pelvic inflammatory disease. Now coming to other options, that why other options are wrong. So ectopic pregnancy, so if that the answer would have been ectopic pregnancy, the patient would have presented first with amenorrhea, then UPT test would have been positive first, then comes vaginal bleeding, not vaginal discharge per se, vaginal bleeding, and then adnexal pain, which is present. Adnexal pain is present. Adnexal pain. Cervical motion tenderness can occur. Yes, cervical motion tenderness can occur, but vaginal discharge is not typical. So vaginal discharge is not typical. And there are raised inflammatory markers like CRP is increased and ESR is increased. So these CRP and ESR strongly favors for the infection, not the ectopic pregnancy. So ectopic pregnancy is wrong. Coming to second option, acute appendicitis. So if the answer would have been acute appendicitis, the question would have told that it started periumbilically, and then shifted to right iliac fossa. It would have told about the MAC burning, tenderness, and acute appendicitis does not have cervical tenderness. So there is no cervical motion tenderness. So that's why B is also wrong. Now coming to third, that is diverticulitis. Generally diverticulitis occur in older age. In older age, the patient will be presenting with left lower quadrant pain, and there would have been bowel symptoms. There is no reason for vaginal discharge in diverticulitis. That why is there vaginal discharge? And why is there cervical motion tenderness? So these are wrong. So that's why the answer will be acute PIT. Now coming to second option, second question, that which of the following are risk factor for the pelvic inflammatory disease? So in the previous question they asked what is the diagnostic criteria for PID. Now they are asking what are the risk factor for PID. No. So use of contraceptive pills, IUD use, genetic predisposition, or sexually active teenagers. So again this question has been taken from the Datta's Gynae textbook. which writes about the risk factors for the PID. And the first option is menstruating teenagers, multiple sexual partners, absence of contraceptive pills, previous history of acute PID, IUD users, and areas with high prevalence of sexually transmitted disease. Teenagers have low hormonal defense in the response to genital tract infection. Wider areas of cervical epithelium allows colonization of chlamydia trachomatis and Neisseria gonorrhoeae. So the risk factors is, so now coming to question again, use of contraceptive pills. This is protective factor. So OCPs protects. OCPs protect against PID. Against PID. So first is wrong. IUD use, yes. Genetic predisposition, yes. Sexually active teenagers, yes. So the answer will be 2, 3 and 4. So B will be the correct option. So B will be the correct option. Now coming to next. Which of the following are symptoms of the genital tuberculosis? So there is mycobacterial infection of genital. Now what are the symptoms of genital tuberculosis? So first is postmenopausal bleeding. So this is wrong. Postmenopausal bleeding is wrong. Generally it's not the menopausal women who are affected by the TB. Generally genital TB affects women of reproductive age. Women in reproductive age. In reproductive age. And then the female will present with the symptoms of amenorrhea. There will be absence of menstruation or oligomenorrhea or hypomenorrhea. Postmenopausal bleeding is not the symptom of genital tuberculosis. So first is wrong. Coming to second option, infertility. So this is correct, and in fact it is the most common presentation. This is most common presentation of genital TB. The couple presented to you with infertility. You did many tests and so find out that there is genital TB in the female, and you treat the genital TB and the infertility is gone. Why is there infertility in the case of genital TB? Because fallopian tube can be damaged. So there can be tubal damage. There can be involvement of endometrium, so endometrial involvement. And there can be adhesion formations. So second is correct. Now coming to third option, chronic pelvic pain. So chronic pelvic pain is due to, this is correct, there will be pain and it will be long term pain. So it's a chronic pelvic pain. Why is it there is chronic pelvic pain? Because of TB there is chronic inflammation. There is chronic inflammation. Then we have pelvic adhesions. And we have tubo-ovarian involvement. So third is also correct. Fourth is oligomenorrhea. This we have discussed, that because there is endometrial destruction and scarring, which can cause oligomenorrhea, that is oligomenorrhea, or hypomenorrhea, or amenorrhea. So option will be 2, 3 and 4. So D will be the correct option. Now coming to next question, 68th question. Which one of the following is the correct regarding the choriocarcinoma? So choriocarcinoma. So first is vaginal bleeding is the commonest presenting symptom. This is correct. Vaginal bleeding is the commonest presenting symptom. So most common presentation of gestational choriocarcinoma will be irregular vaginal bleeding. Now coming to second, about 20 to 30% of patients with molar pregnancies develop choriocarcinoma. No, this is very high. About 2 to 3% of patients with a molar pregnancies develop choriocarcinoma. Now primary site of involvement is fallopian tube. No, primary site is uterus. And the metastatic sites are most common is lung, that is 80%. Then we have D option, that it is highly resistant tumor to chemotherapy. No, this is the most chemosensitive malignancies, chemosensitive malignancies in whole medicine. So in the whole medicine, if there is any cancer which is most chemosensitive, this is choriocarcinoma. That the cure rate, in case of low risk GTN, because of chemotherapy is more than 95 to 100%. And if it's high risk GTN, because of chemotherapy, it is more than 80 to 90%. So such is the sensitivity for the chemotherapy for the choriocarcinoma. So correct answer will be vaginal bleeding is the commonest presenting symptom. Now coming to 69th question. Which of the following are favorable factors in prognosis of ovarian malignancy? So you have a patient who has developed ovarian malignancy. Now you want to tell the patient about the prognosis. So which of the following will be acting as favorable factor in the case of ovarian malignancy? The first one is older age group. No sir, older age group is not the thing for the good prognosis. Rather, younger patients have better prognosis because they have better performance status. They have better response to treatment. And so we have the better survival. So if the ovarian malignancy is in younger age group, this is favorable factor. Now coming to, so first one is wrong. Second option is well differentiated tumor. So this is correct. Well differentiated tumors or low grade tumors are they grow slower, they are less aggressive, and they have better prognosis. So second will be correct. Coming to third one, small tumor volume. So small tumor volume, so smaller residual tumor burden after surgery is one of the strongest favorable prognostic factors. So there was an ovarian malignancy, you performed surgery, and after surgery the small tumor volume is left, and this will be the one of the favorable factor in the prognosis of ovarian malignancy. So third one is correct. Now coming to the fourth one, there is absence of ascites. So there is a patient who is coming to you with ovarian malignancy with ascites, and second is the one which is coming without ascites. So which one will be correct? So the one without ascites will be the one with favorable prognosis, because if a patient is presenting to you with ovarian malignancy with ascites, the ascites indicate that the disease is advanced. So that person will be having advanced disease. And second, it indicates that there is a peritoneal spread. So there is a peritoneal spread. So fourth is correct. So there will be 2, 3 and 4 will be the correct option. Now coming to the 70th question. Which one of the following drug is the most effective in the treatment of gestational trophoblastic neoplasia? So we talked about the GTN is the one which is one of the most chemosensitive tumor in the whole medicine. Now they are asking that which one of these is the most effective in the treatment of gestational trophoblastic neoplasia? Cisplatin, methotrexate, gemcitabine, or none of the above. So the thing is that the chemotherapy is now the mainstay in the treatment of GTN. In general, the patients with non-metastatic or low risk and good prognosis disease are treated effectively with single agent therapy, that is methotrexate or actinomycin. And the patient with poor prognosis metastatic disease should be treated with combination drug regimen, that is IMACO regimen. So if a patient is having low risk disease, there is a low risk GTN, then you are going to just use single agent chemotherapy. And what is the name of that chemotherapy? This can be either methotrexate, or it can be actinomycin D. And if this is the one with a poor prognosis, metastatic disease, then you are going to use the IMACO protocol. In the IMACO protocol, E stands for etoposide, M stands for methotrexate, A stands for actinomycin D, C stands for cyclophosphamide, and O stands for oncovin, which is the brand name for the vincristine. So coming to the question, first is the cisplatin. No, cisplatin is wrong. In the IMACO, C stands for cyclophosphamide, not cisplatin. Cyclophosphamide. Methotrexate, yes, it is used in low risk as well as metastatic tumors. So methotrexate is correct. Gemcitabine is wrong. None of the above is wrong. So it will be methotrexate.